So as many of you know, Dr. Manal Khan is a second-year child and adolescent psychiatry fellow and superstar here at UCLA. Manal was born and raised in Pakistan, where she received her medical education. Before joining UCLA, Manal completed her residency training at the University of Washington, Seattle, where she developed a career enrichment track for cultural psychiatry and global mental health after completing her intern year at Duke. Manal has held several leadership roles during her training. Currently, she serves as the inaugural Justice, Equity, Diversity, and Inclusion Chief at UCLA, the co-director of the Community and Professional Development Committee for the Minority House Staff Organization, and will be the first fellow to graduate with the Psychotherapy Area of Distinction as she simultaneously completes the rigorous child and adolescent psychoanalytic psychotherapy program at the New Center of Psychoanalysis. Manal has presented extensively at national conferences, including APA, ACAP, ADPERT, and AAP, and has also received prestigious honors and awards from several organizations, including the APA Diversity Leadership Fellowship, the ADPERT IMG Award, the Laughlin Fellowship, and the APSA Fellowship. Somehow, Manal managed to accomplish all of this while mothering two amazing boys, Salar and Suleiman, and feels passionately about helping them synthesize a bicultural identity. She also discusses adapting parenting interventions for South Asian immigrant parents with her husband on his YouTube channel. Always acknowledging her privilege, which does not diminish her struggle, Dr. Khan has a strong and unwavering moral compass that fuels her advocacy for her patients, the underserved, and those whose voices may be muted. Please join me in welcoming her today to present on mental health of South Asian immigrants, children of South Asian immigrants, and adapting parenting interventions to meet their needs. Please pose questions in the Q&A box as they come to you, and Manal will revisit them at the end of her talk. Thank you. Good luck, Manal.
Thank you. Thank you so much for your kind words, Dr. Richards. Welcome, everyone. I want to start off by continuing the tradition set by Dr. Zach Schwab to observe a moment to honor Dr. D'Antonio's legacy, who was a mentor and a friend to many people here. I have no conflicts of interest to disclose. If you have any questions, please use the Q&A section of the chat throughout the conversation, and we will circle back to them at the end of the presentation. The learning objectives of this session are broad. I wanted to talk about adapting parenting interventions for South Asian families. However, parenting exists in the context of parent and child relationship, which exists in the context of parent and child as individuals. And it will be a disservice to just talk about the interventions themselves without talking about the experience of South Asian parents and children and how those experiences inform who they come to be as individuals and how then they show up in their relationships with each other. Therefore, today we will discuss the journey of South Asian immigrants, the experiences of their children, and the ways in which we can understand, help, and support them. Why is this topic important to me? Well, I am an immigrant from South Asia, but my family's history of migration did not begin in 2015 when I relocated to the US. My grandparents migrated from India to Pakistan at the time of partition in 1947. My parents were born in Pakistan, so by today's standards, they will be called second generation. I migrated to the US in 2015, and my boys are born here. So we have a pattern going: immigrants, children of immigrants, immigrants, and children of immigrants. My Pakistani ethnic identity is Mohajir, which literally translates to immigrant. This was a term that was used by indigenous folks to identify immigrants who settled in the city of Karachi. This term and identity encapsulates a lot, spanning across generations and continents, as you can imagine. Also, I came across this paper in 2017 as a part of our cultural psychiatry group at UW. This paper attempted to explore the high and growing rates of suicide among Asian American women. The group who wrote this paper worked with 16 individuals who represented this demographic. They were children of immigrants who came from China, Korea, and Vietnam. And the group explored family dynamics and parenting styles as a possible explanation for these behaviors. The group concluded that this empowering parenting style, which they labeled A, B, C, D, G, A for abusive, B for burdening, C for culturally disjointed, D for disengaged, and G for gender prescriptive, was responsible for a fractured identity characterized by low self-worth and double bind, in which you're working towards and rebelling against the ideals set by your parents and society. That creates this web of pain, culminating into substance use, self-harming behaviors, and suicidal attempts. In 2017, I also became mother to a child of an immigrant, and hence this paper had a significant salience for me. I did not want to fracture my son's identity. I wanted him to synthesize his hyphenated identity and draw strength from both sides of that identity. Before we launch into the conversation, here are some definitions of the terms that will be used in this talk. Immigrants to the US are defined as individuals who do not have US citizenship at the time of birth. This includes naturalized citizens, lawful permanent residents, refugees and asylees, and persons on certain temporary visas and undocumented migrants. Children of migrants are those who have at least one foreign-born parent. Children of migrants can be immigrants themselves, and in that case, they will be called first generation. There are also other terms like 1.25, 1.5, 1 and 1.75, which correlate to the age of the migration. Second generation are those who were born in the US and have immigrant parents. South Asia as a region includes Bangladesh, Bhutan, India, Nepal, Pakistan, Sri Lanka, and Maldives. South Asians can be people from these countries and also include those who are part of the global diaspora. It is important to recognize that they are a heterogeneous group of individuals who represent many different countries, languages, religions, traditional values, cultures and customs, socioeconomic status, immigration patterns and status, gender identities, so on and so forth. Therefore, it is important to take into account their multiple, intersecting, and complex identities, and to not treat them as a stereotype or a monolith. While South Asians first migrated to the US in 1700s, the South Asian American community has grown exponentially since the Immigration and Nationality Act of 1965. Some other immigration policies and patterns to keep in mind are the Immigration Act of 1917, which prevented immigration from Asia, and the Johnson-Reed Act of 1924, which precluded Asians living in the US from obtaining US citizenship, while favoring immigrants from Europe. The Hart-Celler Act of 1965 also encouraged immigration of highly skilled professionals and created an influx of South Asian health professionals and scientists into the US. The Immigration Act of 1990 and the creation of the H-1B visa program also resulted in a sizable wave of immigration from South Asia. There are some other terms which will be used during this presentation, and it is important to have a shared meaning for them. I am using Dr. Salman Akhtar's book, Immigration and Identity, as a guide for these definitions. He defines acculturation as a gradual process of autoplastic adaptation to post-migration changes in a variety of realms. For example, topographical, biological, political, historical, economic, social, and psychological. Adaptation is capacity to cope appropriately and advantageously with one's environment. When the individual alters the environment to meet their needs, the resulting adaptation is called alloplastic. When, however, the individual modifies themselves in response to the environment, the adaptation is called autoplastic. Acculturation gap is the term for the difference between older and younger members of an immigrant family in their familiarity and comfort with the culture of country of adoption. Assimilation is defined as the process of losing ethnic rough edges and internalizing the cultural characteristics of the dominant group. And lastly, bicultural self is a widely used expression in the immigration literature for the psychological self of immigrants and their children, meant to denote the coexistence of behavioral attitudes and value systems emanating from two separate cultures. This term has been used by some authors for a phase when the synthesis of the two cultures is incomplete and conflictual, while some others use it to denote a state of relative harmony between the internalized dictates of the immigrants' two cultures. It is also important here to take stock of some of the statistics. As per 2019, 44.9 million immigrants in the US made 13.7% of the US population. Currently, children of immigrants represent 1/4 of the population under the age of 18, and by 2050, they are projected to represent 1/3 of this population. People born in Asia represent 31% of the immigrants, and it's a rapidly growing demographic, projected to represent the largest foreign-born group by 2055. Los Angeles County, and California are popular destinations for immigrants from Asia. Here are two interactive maps from University of Southern California's Price Center for Social Innovation that give us a visual about the immigrant demographic in LA and also in our neighborhood. It is important for us to take in this visual and decide for ourselves if we are content with the representation of immigrants in our physician and patient population. Before we move on, it is also important to know that our data collection hasn't been the best. Asians used to be lumped together, and therefore it is difficult to disaggregate the data and study specific trends for specific subsets. Moving on to immigration and mental health of immigrants. From the outset, we need to recognize three things. No two immigrations are equal. Immigration is a complex psychosocial process, and loss and mourning are inherent to the process of immigration. Let's explore some of the many factors which impact the process and outcome, which then goes on to determine the mental health of immigrants. Firstly, the circumstances of and reasons for immigration matter. Is it temporary versus permanent? Did the immigrant have a choice in leaving their country? Was the decision made for them? Did they have the opportunity for anticipatory mourning, or was the umbilical cord cut suddenly and violently? Were they heading towards a better life, or were they escaping persecution? Secondly, can they revisit their country of origin for emotional refueling, or are they deprived of that opportunity? Emotional refueling, a term adopted from literature on the rich mental lives of children, can be intramural and extramural. Intramural implies access to sources within the adopted country, such as the Desi community here, and extramural implies sources located in the country of origin, like making a trip back home. Thirdly, age of migration is important. As child providers, we are aware of the different developmental stages and tasks that come with each stage. An immigrant child has to go through those stages with acculturation in the mix. Also inherent to the process of immigration is loss and mourning. And therefore, even if the child is not impacted, their parents are, which then goes on to influence parents' emotional availability to their children. It is also important to note that immigration at an old age poses its own challenges, ranging from learning to navigate a new language and culture, limits on independence, intergenerational acculturative differences, the feeling of being unappreciated and unneeded while facing death. Although immigration is a complex process, but if we were to consider just the pre-immigration character and immigration, we can think of ocnophils and philobats. Ocnophils are contact-seeking, security-minded, and object-collecting, and philobats are thrill-seeking, novelty-searching, and independent-minded. And for either category, the immigration will unfold differently. Ocnophils might have a difficult time earlier on, but later can settle down. And philobats might enjoy the novelty in the initial part of the process, but can become bored later on. The nature of the country left also plays an important role in the mourning process. Leaving behind South Asia, which is a low middle resource region, can lead to both separation and survivor's guilt about choosing resources and then relocating to offer expertise to a different set of people. The difference between country of origin and the destination country also plays an important role. As a South Asian immigrant, you stand to lose a lot. You can see the list on the screen, but food and language are big ones. Again, as child providers, we are all aware of the importance of food as a representative of our early nourishment and a structural link to our mothers. Language also plays an important role, especially the difference in the use of language. One might feel that their thoughts are too constricted by this new container of language. Pop culture, familiarity with landscape, history and heroes, attire, etc. A lot is lost in the process. One thing that my husband and I often talk about is how we don't have family pictures, our school report cards and medals, the letter exchanges with our grandparents, and the cards we received from our friends. All of that was left behind in our ancestral homes, whereas we have tons of immigration documents such as the S-2019s, EADs, I-90s, etc. How you're received in the destination country also has a significant impact on the process of acculturation. You can be idealized or you can be a target for paranoid anxieties. This reception for South Asian immigrants can manifest on one hand as being called the model minority, and on the other hand as the perpetual foreigner. Then there is also xenophobia, persecution based on the perceived religious identity in the mix too, especially after 9/11 and subsequent wars and conflicts. It is also important to keep the socio-political climate of the destination country in mind while understanding an immigrant's acculturative process. Do they feel welcomed or do they feel ostracized? Experiences of efficacy in the destination country also play an important role. Being able to keep your career can provide a sense of internal continuity. However, we know that how difficult it is to get your USMLEs done, residency selection process, publications, US clinical experience, etc. These are not easy endeavors. Just for reference, this year, only 6% of non-US IMGs matched to PGY1 positions in psychiatry. Not being able to do what you did in your country of origin can exacerbate feelings of otherization and discrimination. Finally, birth of children plays an important role. Children who are born in the US are citizens and often are a reason for and source of citizenship for parents. They also bring in the culture and community from outside to home. Parents are a very cohesive tribe, and through our culture, their play dates, the woes and joys of parenting, we find community. We also begin to read new books, watch new shows, eat new foods, etc. However, birth of children can also pose challenges. We'll get more into this later, but their hyphenated identities and the acculturative gap can be a source of contention and discord between the parent-child relationship. A lot of what I have shared comes from Dr. Salman Akhtar's book, and now I will share some of the processes which he proposes that an immigrant must navigate. An immigrant needs to move from a place of love or hate to a place of ambivalence. What he implies is that there can be idealization and devaluation of identities and countries, an ethnocentric withdrawal on one hand, and a counterphobic assimilation on the other hand. On one hand, you can idealize the South Asian identity and devalue the American identity. And on the other hand, you can do vice versa. Of course, it will be influenced by a variety of factors, including how you were treated in the country of origin and how you were received in the country of destination. However, it is also important to note that what this can imply for children of immigrants. If parents are only focused on the South Asian side of the identity while neglecting the American side, there can be an acculturative gap, which can create a distance between parent and child. If they are too focused on the American side without taking into account the South Asian side, they miss the opportunity to pass down ethnic pride. And this is important because even though you can see yourself as only American, others might not. And therefore, the knowledge and pride can act as a buffer against instances of prejudice, xenophobia, and discrimination. Therefore, a move towards good-humored and loving ambivalence can offer an integrated acceptance of both aspects of each identity and both identities. About optimal distance, here I want you to imagine a toddler stepping outside the symbiotic orbit with the mother and widening the horizon of their exploration. If too close to the mother, they cannot explore. If too far away from the mother, they do not feel safe. Therefore, they need to tread the path of optimal distance, which unfolds both in the psychic world and in the material world. Thirdly, there needs to be a shift from yesterday to tomorrow to today. If too tethered to the past or future, the immigrant might live in the nostalgic memories or fantasies of return. Therefore, a movement towards today will make them more present. Lastly, the shift from yours or mine to a place of mutuality for both the immigrant and the indigenous populations will enrich and integrate the interpersonal and intrapsychic spaces. On a tangent, this is especially important for how we see children. The privatization of parenthood, which manifests as my child versus your child, holds us back from going full force with advocacy efforts to improve the world for all of our children. While working with immigrant families, especially South Asian families, it is also important to be aware of the differences between collectivistic and individualistic cultures. A collectivistic culture prioritizes social harmony over personal independence and autonomy. This can show up as families' strict adherence to hierarchy and predefined roles within the family. This, along with stigma, dissuades South Asian families from seeking mental health treatment because presenting a good face is important. This also manifests as South Asian parents being differential in how they approach their own treatment. For South Asian youth, extended family, including community members, are viewed as an extension of the family. The non-biological aunties and uncles may be perceived as both a source of support and also they can be surveilling they can be monitoring and policing youth even into the adulthood. South Asian youth straddles a collectivistic family culture with an individualistic societal culture. Some of the age-appropriate explorations, for example, with sexuality, gender, career choices, religion, etc., can be seen as a sign of disrespect by their parents and elders in the family. It is also important to be aware of the intergenerational transmission of trauma, the ghosts in the nurseries of South Asian American babies. This was a region that was colonized by the British for a long time. Then it underwent very violent partition in 1947. Many regions in South Asia have seen years of internal conflict and wars. Immigrants who leave their country of origin might have been victims of ethnic cleansing, persecution, violent patriarchy, financial adversity, and socio-political challenges. So please be aware of their limited institutional currency. There can be a tendency to see their parenting as harsh and devoid of emotion. When that happens, try to take a pause and think of what they have survived, the defenses that they needed to deploy to survive, what is being asked of them in the destination country, and do they have realistic access to time and resources to enact what is being asked. Okay, moving on to the children of immigrants and South Asian American kids. Here is an edited video of Hassan Minhaj talking to brown or Desi kids about the experience of growing up in the US. Let me see if I can play this.
All right, real quick. Say your full name and then say the way white people say your name. So my name's Hassan Minhaj. I would get Hansen Minaja. I'd get Sahan Minha. I'd get Sean. I'd get...
Sean. My name is Jana Aja Duki. People say my name, Jana Aira Duki.
Okay, so my name is Sahir Mir. People would call me Sahir Mur and then like Cher.
My full name is Preksha Kalavar, and people pronounce it Preshka Calamari.
Oh. My full name is Pavan Datta Kalaru, and all my friends at school, all my full-time teachers, they call me Pavan. That's like my white name.
Yeah, my name is Tejashree Vijaykumar, but I go by Teji. Most people say Teji. I had a teacher that called me Tevi for half a year.
Tevi?
Tevi.
Heavy?
Yeah.
I'll be honest, I've rolled with that too.
Yeah.
Like when people are like Hassan, I'm like, fine.
Okay, so my name is Abir Khan, and no one ever pronounced my name wrong.
People get it right 100% of the time?
Not 100%. Like, people spell my last name wrong. Like, K-A-H-N, that's how they say it. It's
Okay.
K-H-A-N.
Okay.
My name's Suhani Madan. Like when people like read it off attendance, or like Shuni, or like, but also my friends call me Susu, which means pee. I just went with it.
You went with Susu?
I mean, I was the one who knew what that meant, so like they didn't really know, so like it's fine.
Abir, what would you do if someone called you pee-pee?
I would say it back.
Oh, you'd be like, no, you're pee-pee.
I would get an Uber reverse card. I'd pull it up, and I'll be like, no, you little pee-pee.
What is the most stressful thing about going to school right now for you personally? Is it just academics?
Yeah, well, also the fact that people just can't seem to wrap their head around the fact that I'm brown.
Okay.
There's no other brown people in my school.
There's not that many Indians. We have like 7 guys, 2 girls in my grade. I got a lot of crap for being vegetarian. I was like eating like yogurt or something at lunch, and people had these chicken nuggets. They're like trying to get it in my food.
Did you ever think you're like, all right, I'm just gonna have one chicken nugget?
When I was younger, yeah, but not anymore. I'm like,
Because I had the same thing with pepperoni.
yeah, like
I was just like, God will understand.
my friend would like print out pictures of like cows, like, here you go. I'm like, why are you giving me this picture? Like, you worship cows, right? I'm like, shut up.
If someone ever did that to me, I would have gone down to the cafeteria, I would have gotten the milk tray, just smacked it right at their face.
I respect that. Have you ever gone through something like that?
My school's like 60% Indian. Like, I've got a couple people like say things about me being Muslim though, because everyone there's like, you know, like Hindu.
Yeah.
So they'll just be like, oh, so you're from like Pakistan, right?
Right. Hating Muslims is timeless. I mean,
Yeah.
that's just like a.
That's just I don't think that's.
Yeah.
go away.
It's a
for while.
classic, you know what I mean?
For vacation, like sometimes American people, they go to like different places like France or Cancun or the Bahamas. You know what Cancun is?
Yeah, I know what
Yeah.
Canada
No. Okay, so like my friends, they would say like they went to Germany or like a bunch of fun places like Disney World.
And then where would you go?
So like I would just say like I went to France to see the Eiffel Tower because I didn't want them to know that I actually just went to India like all the vacations.
It was the same thing for me. My parents, every time we would go on vacation, we'd just have to go to India. They're like, if you're gonna go on a plane, we have to see your grandparents.
Yeah.
If you wanna go on a date, what do you do?
You
I'm not allowed to date. Are you crazy?
We're all brown.
It's like,
We don't date.
Yeah.
I just tell my mom.
You run it by your parents?
I tell my mom.
Do you tell your mom?
You tell your mom?
Say that to me. I'm like, nah.
She's like, oh, you can have a boyfriend, you can do whatever you want, you can have fun, but like, just don't be too serious about it. Like, don't like fall in love with somebody or just like get too deep into it.
That's the most Indian thing ever.
Right?
You get attached to someone you love, you won't be able to study. Do you think your parents will be cool with interracial dating?
Yeah.
My sister has a white boyfriend.
Whoa, what's the white boyfriend like?
He's nice. I like him. He's
No,
funny.
it's not like, what do your parents think?
Oh, my parents?
Yeah, I'm sure you're cool with it. Of course, we'd all be cool with you. You'd be,
So
I'm not, you're not like, he's
my
the devil.
parents-
He's the white devil, but it's okay.
I think my parents would be less okay, but he also has as like impressive credentials as my sister does. My sister goes to Yale Med and he goes to Yale Law.
Oh, cool.
So that's what I mean by equally impressive. Yeah, exactly.
Yeah, it's a match made in heaven.
Right, yeah.
So, dating is still not cool.
Not until you're in college.
My mom
Or
yells
once
at
you've
me.
gotten into college.
Not until
you're
we're
fine.
like
Your parents say, oh, you can date in college, you have fun there. We all know that's not true.
What?
What do you mean? Why not?
If you're going to med school, how can you have fun with the relationship?
Yeah.
Is medicine still the thing?
Yeah.
Yeah.
I've been asking a lot of people this because I'm applying to college, but like, what did you apply for when you were applying to college?
What did I apply for? I applied pre-med, and I was an idiot. Are you nervous?
A little.
What's the expectation? Are your parents like Ivy or bust?
Yeah.
What do your parents want you to do with your life?
Anything in the medical field, but on the side, they said I could do something else. But I always have to have a backup
But
plan.
why does everything, why do our dreams have to be on the side?
I don't know.
I want to be a cool 2019 brown parent.
Yeah.
So what am I going to do? You guys tell me.
No beating.
Yeah, no
Okay,
beating.
Don't do that.
Okay, no hitting. I know hitting
Let
is
her
not
hang
the
out
thing.
with her friend.
What if it's a boy?
Oh, it's fine. It's a friend.
Yeah.
At some point, it's
At your
fine.
house.
You really want me to let my daughter hang out with one of her friends that's a boy? You tell me. My daughter's 16. She goes, Abu, this is my friend Cody. We're going to go to the movies. He's my friend. We're just going to hang out.
Let her go.
Fine.
Let her go. Put a camera
For
on
real?
her. Track her
So put a
phone.
camera. I'm totally fine with that. I'm totally fine. Why? Why can't I spy?
You don't want to stop
You
your kid.
spy.
That makes them hate you more.
That makes them
The
rebellious.
thing is,
Here's what I'm going to do. I'm going to put a camera on her. I'm going to go, look, it wasn't me. It was the U.S. government. They survey Muslims.
Yeah.
my parents give me like freedom, right? So then that makes me like, I don't hate them. But I see other friends who are like, oh, my parents are super strict. They don't let me do this. They don't let me do that. Then they always just talk crap about their parents behind their back. Let
That's
your kid
beautiful.
have-
So your parents trust you.
Yeah.
Should they trust you?
Yeah. I don't
Do
do
an episode of
anything.
Patriot Act. What would you do your episode on?
Well, I think like doing between like the difference between like South Indian and North Indian thing.
Oh, that would be dope.
Indian stereotypes. Like the Indian Standard Time. That's what I get a lot.
No, I feel like a lot of people get like they just group India as one. There's so many like different parts of India, like different culture and different language. Like, do you speak Indian? No. Like, which Indian, brother? There's so many languages.
I was walking with two friends, and one of them asked me like, "Oh, do you speak Indian?" And then the other girl said, "No, you idiot. She speaks Hindu."
They compare you to every single brown person. Like, they're like, are you related to Priyanka Chopra? And they say their names like all messed up. I'm like,
Wait, do people ever call you like a coconut or anything?
Oreo.
A, B, C, D.
I've been called an ABCD.
American born confused Desi.
Do you feel like you're confused about your identity?
Oh yes, please.
What do you mean? Abir, you're the most confident person
I'm
I've
kidding. I'm kidding.
Abir, you're
Okay, American born confident Desi.
Here, dab on that, dude. This has been super illuminating, and it's definitely been one of the craziest afternoons of my life. All right, real quick, say your full name.
Okay. The video highlights many things: bullying and stereotyping in school, academic expectations, and expectations with regards to peer relationships. In immigrant mental health literature, there is an assumption that being foreign-born affords some protection against mental illness. It is known as the immigrant's paradox. suggesting that people who migrate are more resilient than those who do not, and therefore represent a healthier pool of people. There's also literature suggesting that with longer time spent in the US, this advantage diminishes and disappears. For adolescents, however, the results are mixed. There is some buffering against externalizing problems, but children of immigrants, particularly those of Latinx and Asian backgrounds, have higher incidence of internalizing problems. Similar to adults, the mental health advantage for adolescents with regards to externalizing behaviors dissipates with longer time spent in the US. With immigrants and children of immigrants, it is also important to track both transcultural, cultural, and culture-specific factors and the interaction of these factors. For example, economic pressure and neighborhood disadvantage, which are transcultural factors, can independently influence the mental health of this population. However, these factors can also interact with other factors, such as discrimination, which is a culture-specific factor to create additive and integrative impacts on mental health. Discrimination is a big culture-specific factor. It has been studied as everyday discrimination, discrimination based on one's race and ethnicity, and discrimination based on the assumption that children of immigrants are foreigners. Discrimination is experienced from peers, adults, and vicariously through discrimination experienced by parents. These experiences of discrimination adversely impact the mental health of children of immigrants. Acculturative stress can manifest as family stressors, discrimination stressors, language stressors, peer stressors, and anti-immigrant sentiment, and can also impact the mental health of children. Parenting is another important factor to consider, and we will get more to it later, but the thing to keep in mind is that there are different parenting styles within immigrant populations. These styles develop in a context and can serve some adaptive function, but these parenting styles can influence the mental health of children of immigrants. Regarding ethno-racial socialization, again, like everything else, a nuanced understanding is needed. Strong ethnic pride is a protective factor. However, preparation for bias stemming from a negative perception of one's own ethnic group, coupled with expectation of adult discrimination, can be a risk factor for poor mental health outcomes. Acculturative gap is also a significant factor impacting the mental health of children of immigrants, with bicultural parent and bicultural child dyad reporting more supportive parenting with lesser incidence of depressive symptoms. Language brokering is an important and common phenomenon within immigrant families, and this too can have a variety of impacts on the mental health of children of immigrants. Context and frequency of language brokering matters. Parentification, along with frequent language brokering, confers the highest risk for discrimination and depressive symptoms. Code switching is another important factor that needs to be taken into account. It implies adjusting style of speech, appearance, behavior, and expression in ways that will prioritize the comfort of others, avoid differential treatment, and comes from a place of wanting to fit in. This also happens with immigrant adults who code switch between 9 a.m. to 5 p.m. and then revert to their ethnocentric identity at home. As you can tell, it can lead to splitting and disintegration of identities and the feeling of never being enough, not Desi enough, not American enough. It is important to note the intersectionality of identities that can be a risk factor for children of immigrants. South Asian American youth identifying as LGBTQ+ are at increased risk for discrimination, racism, and internalized heterosexism. There is also stigma with regards to disclosure, given that some immigrant households can be very collectivistic, hierarchical, and gender prescriptive in nature. This can confer a higher risk for anxiety, depression, and PTSD. It is also important to note that South Asian American girls especially might not feel comfortable sharing their dating experience with their parents, which then puts them at risk for teen dating violence. Lastly, academic pressure is an important stressor for South Asian children. Education is often seen as a means for upward mobility by South Asian parents who consider academic achievement as a way to restore lost prestige. It can also be important from the perspective of presenting a successful front for homo-ethnic community. This then results in Ivy or bust notion that you saw in the video. Given all of these factors impacting the South Asian families, here are some general clinical considerations for those working with them. Firstly, Dr. Kleinman's important work about explanatory models of illness and recovery, along with DSM's focus on cultural interviewing and formulation, and Dr. David Mint's work on keeping patients' developmental goals as opposed to mere symptom reduction central to our work with them has important lessons for us. It is important to note that South Asian parents and families might not completely align with a biological explanation as the only cause of their illness and medication management as the only treatment. Bringing in psychosocial and even spiritual elements into the treatment can yield more traction. Also, it is important to recognize that a body-brain continuum and medical understanding can alleviate some of the stigma that originates from conceptualizing mental illness as a moral or personal failing or deficiency. The body-brain continuum is especially important for South Asian families since the psychiatric disorders can present as somatic concerns. It is also important to recognize the language differences can impact our communication with patients, and hence it is important to provide psychoeducation in a way that optimizes understanding that is free of medical jargon. Sometimes it can feel exhaustive to provide psychoeducation, especially in a way that challenges us to reconsider our words and our sentence structures. And therefore, it can be tempting to either not provide or only partially provide psychoeducation. This is also, of course, a product of our limited time with patients. However, these families coming from collectivistic cultures can be very differential and hesitate about asking questions or requests for clarifications. Therefore, intentionality is required on the part of the provider and physician to proactively provide comprehensive psychoeducation. As we know, it's not only a didactic tool, it's a therapeutic intervention. Physicians should also be aware of their own bias while working with immigrant families. It is important to keep the concept of institutional currency in mind. These folks have been through a lot and had to overcome a significant stigma to seek our help. Therefore, our implicit and explicit bias about their explanatory models of illness, their ideas about recovery, their sources of resilience are unwarranted and damaging. It is also important to be deliberate regarding the confidentiality concerns. The South Asian youth, especially, if there is an acculturative gap, might not share an open relationship with their parents. Lastly, it is important to recognize that there are heterogeneous community and there will be significant variability. Therefore, being curious and humble is key. On your screen, you can see a visual that illustrates an approach that can be used in work with diverse patients. Now, having established the unique challenges faced by South Asian families, let's talk about adapting the parenting interventions for this specific demographic. As child people, we know the importance of parent-child relationship. This relationship sets the template for future relationships. Parent-child relationship plays a significant role in determining the mental health outcomes for children. Parent training is noted to be effective in reducing both externalizing and externalizing behaviors for children. However, parent training for economically disadvantaged, immigrant, and ethnic minority patients yields poorer outcomes because of limited engagement and high attrition rates. Skills taught in parent training can be perceived as culturally incongruent by immigrant parents. For example, when asked to praise their children, immigrant parents of Asian origin might be reluctant to adopt the proposed skill, as they can view excessive praising as being a conduit for complacency and lack of humility. Therefore, it is paramount to deliver parent training within a culturally informed framework for optimal success. Dr. Anna Lau and her group has done interesting and pioneering work with high-risk immigrant families of Chinese descent. They adapted programs from Incredible Years parent training. In addition to the programs, they provided cognitive restructuring to identify blaming attributions that led to punitive discipline, or helpless thoughts that led to inconsistent discipline, and replace them with non-blaming, self-efficacious thoughts that mobilize effective behavior management. They also provided communications training to resolve common conflicts within the family by active listening, problem-solving steps, and structured family meetings. This intervention was delivered over the course of 14 weeks. The intervention was delivered in a group format. It was delivered in a collaborative manner, and participants were given the space to discuss practical and cultural barriers in applying these skills. The facilitators leading the group noted that opportunity to role play and longer time practicing skills contributed to successful delivery. There are important lessons to be learned here. I have participated in some YouTube videos to address the parenting skills with South Asian Urdu and Hindi-speaking populations. It is important to acknowledge where South Asian parents are coming from and how they can feel hesitant using the skill. For example, for our video on praising children, we acknowledge that Asian parents might not feel conflicted about this skill. See the reservation section on the screen. However, we found common ground with them. Parents typically want their children to be successful. We discussed parents' language for their children will go on to become the language of their own autobiography. How parents can give them new ways of seeing themselves and how criticism does not promote growth. Also because Dr. Paris said so. We also talked about how the praise can be behavior-based as opposed to evaluative. So instead of saying how good your child is, you can acknowledge how hard they worked. And in doing so, you're increasing the likelihood of them working hard again. You can see some of the do's and don'ts of praising that we discussed in the video on screen. Oops. I have been thinking a lot about combining DBT skills, dialectical behavioral therapy skills, with parenting training to enhance parents' capacities for mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance. I say this because to provide immediate and descriptive behavior-based praise, parents need to be present in the moment and use the what skills. Also, to steer clear of judgmental language, they need to use the how skills. To be advocates for their children, they can make use of dare men. And to provide validation, they can incorporate the 6 levels of validation from DBT literature. Cope ahead can be used to develop parenting plans, and accumulating positives will allow parents to engage in self-care as a means to address their own vulnerabilities for emotion dysregulation. Crisis management skills from the distress tolerance section can be used in high conflict and stressful situations, whereas radical acceptance skills can be employed in service of accepting their children's bicultural identities. We have many tools in our toolbox, including our knowledge and understanding of the US healthcare system and school system, our understanding of these processes that immigrants undergo, the developmental stages that children and adolescents must navigate in consolidating their identity, the impact of intergenerational trauma, etc. And if we bring all of that together, we can really help these families in a comprehensive manner. The crux of this all is to know the experiences of the families that we work with, their unique challenges, and then to adapt our interventions to meet where they're at. Here are some of the resources for working with South Asian families. They are specific to California. I can send them out in case someone is interested. These are some of my references. A big thank you to all of you for attending and staying till the end. A huge shout out to Dr. Richards for being a part of this conversation. Please feel free to send your questions my way. In the end, if there is time, we might listen to South Asian music that captures the Sufi culture, the culture of cognitive flexibility, embracing uncertainty, rooting yourself in something bigger than yourself, and humility. I want you all to leave with something celebratory and meaningful. I'll stop sharing the screen now.
That was just wonderful. Thank you so much for such a just thought-provoking presentation. We actually have a question that I'd like to read out loud, and hopefully you feel comfortable addressing Dr. Khan. So, what are the common clashes of perspectives between South Asian immigrant families who are experiencing mental health challenges and the non-South Asian clinician who must now assist these families? And what specific steps are needed to mitigate the potential clash of values and clinical ideologies? You mentioned general points to consider given the many insults these families have experienced over multiple generations. Are there other specific interventions to consider?
So no, that is a good question, and it is a long question, so I'll try to address the multiple parts of that question. I think it is important, like for non-South Asian clinicians working with these families, it is important to note that it is a collectivistic culture. I don't know how many of the people here know Dr. Shashank Joshi. He's the program director at Stanford's Child and Adolescent Psychiatry program. And he talks about how he was working with this South Asian family and he failed to address the Dadaji or the grandfather in the family. And that was the rupture that resulted in that family never coming back to their office again, because the Dadaji or the grandfather was expecting some kind of display of respect and inclusion towards him. So knowing that these families are collectivistic in nature, that there is a hierarchy, keeping that in mind while you're approaching them, trying to include parents, and also being aware of, like, you have to include parents, but also being aware of the confidentiality limitations or the privacy limitations, because there's a difference between confidentiality and privacy. So knowing that, because a lot of times the South Asian youth might not be completely open with their parents with regards to their own mental health issues, and also with regards to different explorations that are going around. So knowing that is important. And then I think the other part of the question was, what specific steps are needed to mitigate the potential clash of values and clinical ideologies? I think integrating the biopsychosocial model, because I mean, this comes from the work on global mental health as well. When we medicalize the psychiatric illnesses too much, it is also counterproductive. So also knowing that, yes, the medical model helps with reducing the stigma, and it takes away the focus from this being a personal failing or a deficiency to being something that someone's experiencing given their psychosocial context. But also, and also with regards to treatment, also bringing in elements of psychosocial and spiritual elements, because a lot of people would want to go to temples. A lot of people would want to incorporate their mosque into the treatment, their community, all of those things. So yeah, that would be it. Okay, and am I missing anything?
I think you got, let's see, and what specific steps are needed to mitigate. You got that potential clash of values. And you know, we have another question. I just want to make a comment that the video of the children was so powerful, and just their perspectives about even pronouncing their names and how that feels to them, and how they experience teachers knowing them for up to a year and saying the wrong name. Very powerful video. Thank you for sharing that. Another question, I'll just read it out loud. So I'm curious if you have any specific comments relating to differences in South Asian immigrant experiences based on the family's original cultural experience in the country of origin. I was very struck by the issues raised in Isabel Wilkerson's book, Caste, and wonder if or how they may be relevant to this discussion.
No, this is a really good question, because yes, I mean, South Asia is not a monolith. Even like if you take one country, even Pakistan, if you're talking about Pakistan, which is my country of origin, even if we take that, if we talk about that, northern part of Pakistan is very different from the southern part of Pakistan. I come from an urban place, which is Karachi, which is the largest city in Pakistan. But the experience of someone living in Karachi is going to be very different from the experience of someone living in Khyber Pakhtunkhwa, which is or Waziristan, that has faced drone attacks or something like that. So even within these different countries, within this region and between these countries, the experiences are going to be so varied. And you're right. I mean, the caste system plays an important role for some of these for some of these families. I don't know if this happens outside. To what degree it happens outside of the country, because I mean, once you become a minority, become more inclusive and accepting, and you kind of start to meld together and start to glue together. But that is a huge thing, and it is important to take that particular family into consideration. There are going to be elements from the South Asian culture, but there will be elements that are going to be specific to that particular family itself as well.
Beautiful. Thank you so much for that. And again, if you have any questions in the audience, you know, just click on that Q&A box and put them in. We have another question that came in. Given the importance of ethnic pride for bicultural children, what are some specific ways we can foster, encourage a positive bicultural identity in our children?
Ooh, that's a good one, because I have been thinking about that a lot for my own children. And I think one of the things that sometimes I think organically happens is like using language around the children. That some things organically happen. You use language around the children. We use like music, South Asian music around our children. Our children, like I'm saying our children as if they're older, but our 4-year-old and our 9-month-old, our 4-year-old actually does really like Coke Studio, which is I think Pakistan's very proud product for the world. he enjoys listening to that music. Having friends from within the community. Some families will take, and these are also intramural sources of emotional refueling for parents, taking them to community centers, taking them to the mosque or Islamic school or something like that, or the temple or the Gurdwara, can be helpful, so that they have friends from the same ethnic identity as them. They can discuss Bollywood, they can discuss movies, they can discuss music, they can discuss similar food. So all of that, I think, helps in bringing together those sides of the identity. Dr. Akhtar actually writes in his book that once you have a guest list that is mixed and has American folks and South Asian folks coming to your dinner or your event, that actually goes on to show that you have kind of like integrated yourself into the mainstream culture while also maintaining your own South Asian bent.
Beautiful response. As a person myself, who Asian mother and a Caucasian father, it's interesting because that was big in our household, is maintaining customs, and we would do that on the weekends. We would go out on these trips and basically understand kind of more about the Chinese culture and Japanese culture. Thank you for sharing that. We have another question that came in. Any good shows that do a great job of presenting the challenges of acculturation for South Asian families?
Ooh, that's a really good one, because I do have a show that I want to recommend. Never Have I Ever is a show, and it's the second season has come out. So that is a show that talks about the South Asian, challenges faced by South Asian family. It is like the family is based in Sherman Oaks, so even the references are very kind of like will be relevant for people in California. There's Miss Marvel, Miss Marvel is coming out, and the protagonist is Pakistani. So that is a huge win for South Asian community. Then I don't know if you folks saw Oscars. Riz Ahmed won for a documentary, The Long Goodbye. So there are, and he talks about, and I think that is about belonging. And his Oscar speech was wonderful. He talked about there is no us versus them, there is only us, and we have to come to that realization quickly. So that was a beautiful documentary as well. So there are a lot of resources out there.
Thanks so much. So Never Have I Ever is at the top of your list. Just want to make sure, get this right.
Never Have I Ever, Miss Marvel, The Long Goodbye. There a lot of them out there.
Thank you, Dr. Khan. So another question came in. Hearing about the racism faced by South Asians in the US, and knowing that many parents fear their children losing connection and valuing of their own culture, how do you think about anti-racist frameworks can support this work?
I think I don't know if I fully am understanding this right, but I think this is a wonderful question, because yes, I mean, on our end, and this came up during the BLM conversation as well, that within South Asian culture racism can exist. So being aware that racism is can exist within all of the communities, and also being aware of how they can also be subjects of that racism from the mainstream community, and just being aware of our own biases when we come into encounters with these families. One thing that I'm always mindful of is that even with Zoom, for example, sometimes if you have an accent, it can become difficult for the other person to hear you out on Zoom. So also being aware that how is that playing a role in how much attention I'm paying to my patient. How am I showing up? Am I being more paternalistic in my approach with them? Because I think that is another tendency that a lot of us have, is that, okay, you are not understanding this, I'm going to come in and I'm going to tell you what to do. So being aware of how these things come up for us, like our own counter-transference, and paying keen attention to that is also really, really important. And also being aware of how racism within South Asian community can manifest. As someone was saying before, there is caste system that can come up within these communities. There is ethnic divisions that can come up. There is religious and sectarian divisions that can come up. So there's a lot.
Thank you so much. We have just maybe 1 minute left, and wondering, Dr. Khan, how long is the song that you wanted to play?
I can, like, if people want to stay, it's 6 minutes long. I would want us to hear this song out because I mean it does talk about like that cognitive flexibility. So I think it is a beautiful song. Send me your feedback, okay? So I will share the screen. You guys can see it?
Yes.
Okay, I will play it.
Coke Studio, Season 14.
ਸਭ ਨੂੰ ਸਮਝ ਕੇ ਕੀ ਕਰਨਾ ਏ ਦਿਲ ਨੂੰ ਐ ਸਮਝਾਵਾਂ ਤੂੰ ਝੂਮ 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 ਤੂੰ ਝੂਮ 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 ਮੈਂ दीवानी कुछ ना जाना मस्त होके गावा दुनिया राजी करके कमले फिर भी चैन नहीं आना सारी खुशियां मिल जावन ते पिछे की रह जाना सारी खुशियां मिल जावन ते पिछे की रह जाना तेरे बस में कुछ भी नहीं है दिल नू ऐ समझावा तू झूम झूम आसमाना मैं हंसदे हंसदे है जीना मैं निकल गई घुमाना तू मैं ते मेरे वर्गियां की खुद को शर्माना दुनिया राजी कर भी लइए फिर भी चैन नहीं आना जो है तेरा लब जाएगा करके कोई बहाना तेरे बस में कुछ भी नहीं है दिल नू मैं समझावा तू झूम 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 तू झूम झूम झूम
I think in the interest of time, we can stop here. But just wanted to give that good taste in the end.
That was just such a beautiful way to end a beautiful talk. Thank you so much for speaking with us today, Dr. Khan, and hope everybody has a great rest of your day.
Yeah, thank you so much. Thank you. Take care. Thank you.